Thank you, Dr. Nunes-Smith and members of the Health Equity Task Force for the work that you're doing to lift up and give voice to marginalized communities and for convening this task force. Its mission is absolutely critical now more than ever. My name is Kirsten Baker, and I am CEO and co-founder of Jeenie, a mobile technology platform that connects you to video or audio calls with live interpreters at any time of day for on-demand language assistance. Healthcare providers and community organizations across the country are using Jeenie on mobile devices, landlines, or computers to ensure effective communication during in-person patient visits and telehealth consultations. I've dedicated my career to the belief that language is a basic human right. We founded Jeenie to eliminate language barriers and to create more equity and justice in areas like healthcare, law, education, immigration, and refugee support. This mission is at the core of our work right now in U.S. healthcare as we help caregivers communicate with all patients, including those who are deaf and hard of hearing and those who have limited English proficiency. The problem of misdiagnosis and mistreatment in healthcare that results from language discordance has been greatly exacerbated by COVID. This is due to the virus's disproportionate impact on underserved populations, its urgent nature, and the distancing it has forced among people. Jeenie is working with federally qualified health centers, free and charitable clinics, and community health centers, as well as other nonprofits in social services and humanitarian aid, all organizations who have been utterly overwhelmed for the last 12 months at the front line of this crisis and who are now bracing to take on vaccine dissemination. The urgent pain point that drives these organizations to our doorstep is language. Even the best intentioned are struggling to deliver equitable healthcare access and treatment to limited English proficient and deaf patients due to language barriers and the lack of means to overcome them at the point of care and in the moment of need. Imagine for a moment, all of you, that there's no audio on this live stream and that you don't know American Sign Language. You only see mouths moving. That's essentially what the experience is for a limited English speaker when they show up for a healthcare appointment. This is one area where I hope the task force will choose to make a substantial investment and difference. There are many deep-rooted systemic causes of health inequity, which will take time to overcome, but language is one impediment we can solve for today with the tap of a button. The FQHCs and the other federally funded health organizations that will lead the charge for health equity in the administration's COVID-19 response and vaccine distribution desperately need access to on-site interpreting at testing and vaccination centers in order to inform patients, ensure proper adherence to protocols, and to build trust. We ask this task force to design and execute a vaccine dissemination and education strategy that incorporates real-time on-site interpretation at the point of care along with translated materials. Such a strategy will demonstrate the positive effect of language access on diagnosis accuracy, treatment outcomes, cost of care, and overall health in our community. This would better our collective understanding of the impact of language access on linguistically and culturally diverse communities, as Dr. Martinez was just referring to, and better inform public health policy as it concerns issues of health equity and health justice. I greatly appreciate the opportunity to comment today, and thank you again for all the work you do for our communities.